back to the next video in our series to support diabetes insipidus patients, or as it's now got to be known, Arginine Vasopressin Deficiency. So I'm here with Professor Wass, and in this series of the videos, we are going to talk about balancing fluid and breakthrough. So over to you, Professor Wass. Thank you.
Thank you, Debbie. So a person who doesn't have arginine vasopressin deficiency normally is able to concentrate urine through the effect of antidiuretic hormone or arginine vasopressin on the kidney. And why do you not get up all the night to pass your urine? Well, there's a circadian rhythm. That's a sort of hormonal rhythm every day. And the circadian rhythm means that actually you pass less urine during the night. Obviously, that's not the case with arginine vasopressin deficiency. And so that's something that's missing. So what we need to do if we've got arginine vasopressin deficiency is essentially to balance the fluids and to be conscious of balancing the fluids, because your own body can't do that itself. And I think that's quite important, that's obviously the fundamental problem, if you like. And I think that most people, and I think you'd agree with this, Debbie, should be drinking to thirst. You shouldn't be drinking to a habit. And so if you're thirsty, you can drink. If you're not thirsty, you don't need to drink. And I think that that's important, that you don't drink out of habit. Now, what about the desmopressin dosing? Because most people don't have DDAVP, which lasts 24 hours. They may need some at night and some in the morning. And this is something which is also important. And I'd like to just talk about something when this is a bit serious now, but it's quite important for balancing, if you like, the fluid books. And so you must be careful not to take too much DDAVP, because what can happen is if you actually do take too much, your sodium in the blood goes down, and actually you can get what's called cerebral edema, so swelling, slight swelling of the brain, which will cause headaches and things. And so a lot of people with diabetes insipidus, and Debbie's talked me through this, manage this by having a breakthrough. They take their DDAVP and then they'll have an hour when they know it's not working and they're passing a lot of urine. And that's called a breakthrough, which can help to manage the condition and avoid excessive fluid accumulation. And I think that's probably quite an important concept with patients who have arginine vasopressin deficiency. Some people say omit the DDAVP for a day a week, but I think that's not a sensible way forward. You can omit it for a year, for an hour or so, and that's the best way. And I think the other thing that's important is to remember that it's not necessarily the case that you should take it at exactly the same time of day. Temperature, if you're, let's say, you're in a tropical country, you'll need to drink more and be conscious of the fact that you have extraneous fluid loss from sweating and so on. And so exercise and stress and food and water intake can also all affect the duration and efficacy of the DDAVP. And so having a sort of flexible attitude to it is really important. If you've successfully excreted extra fluids during breakthrough, you'll notice that there's a large urine output, an urgency for an hour or so. The urine's nearly colourless because it's not concentrated, and then you feel excessive thirst. And those are the signs when actually, if you've had a successful break in your DDAVP, that actually it's time to take some more. There are other things you can do. You can weigh yourself. But I don't think it's necessary to weigh yourself on a regular basis. And I think that just keeping an eye on things, and some people, and Debbie will know about this, actually can sense whether they've had a little bit too much DDAVP and that their sodium is down because they actually get a little bit of a headache and so on. And actually what's coming up very soon is the possibility that we can actually measure sodium in the saliva, which will make life a lot easier for people with arginine vasopressin deficiency. So there are lots of exciting things on the horizon.